Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is the patellofemoral joint? The patellofemoral joint is where the back of your patella, kneecap and femur thigh bone meet at the front of your knee. It's involved in climbing, walking on an incline, and several other knee movements. It's also the joint affected by a common injury called runner's knee. /r/n/r/n. The patellofemoral joint is a complex structure involving not only bones, but a network of muscles and connective tissues. All of the bony surfaces inside the patellofemoral joint are covered with articular cartilage, which is slippery and helps the bones glide smoothly against each other when the knee bends or straightens. /r/n/r/n. The underside of your kneecap sits in a groove within your thigh bone called the patellofemoral groove. Within this groove, the kneecap mostly moves lengthwise, but it has some side-to-side movement and can tilt and rotate as well. /r/n/r/n. When you contract the quadriceps muscles of your thigh, they pull on the quadriceps tendon that attaches to your kneecap. This makes your knee straighten. Two of these quad muscles keep your kneecap in the femoral groove during this motion: the vastus medialis obliquus and the vastus lateralis, which are located on the inside and the outside of your thigh. /r/n/r/n. Some daily motions that work your patellofemoral joints include /r/n/r/n. These are the types of everyday activities the patellofemoral joint was designed and evolved to perform. It works well, but, like the rest of your body, it undergoes wear and tear from almost constant use over the years. In addition, taking part in sports can lead to overuse and damage to the patellofemoral joint. /r/n/r/n. Since the patellofemoral joint is involved in almost everything that involves your legs, it's highly susceptible to injuries and wear and tear. The most common ones include /r/n/r/n. When the articular cartilage in the groove and on the back of the patella wears away, the joint becomes inflamed. This is called patellofemoral arthritis. As the cartilage breaks down, it becomes frayed and can leave the bone exposed. The surface of bones is rough, and it's painful when they grind against each other. /r/n/r/n. Your risk of patellofemoral arthritis may increase if you've ever fractured your kneecap or have a condition called dysplasia, in which the patella doesn't fit properly inside the groove. /r/n/r/n. Misalignment or repeated contact of the joint surfaces may lead to patellofemoral pain syndrome, which is characterized by joint irritation and inflammation, knee pain, and limited range of motion in the knee. /r/n/r/n. The key symptom of patellofemoral pain syndrome is pain under and around your kneecap. Irritation of this joint is generally caused by /r/n/r/n. Patellofemoral irritation may also lead to the breakdown of cartilage, flexible connective tissue, on the underside of the kneecap, which is called chondromalacia. In its most chronic form, this condition may require surgical repair. This is a common injury in runners, soccer players, skiers, and cyclists. /r/n/r/n. Symptoms of chondromalacia include a dull pain under or around the kneecap. This may be felt when going up or down stairs or getting out of a chair. Chondromalacia can be due to long-term wear and tear, muscle weakness, or knee alignment problems, or it can develop after a fall. /r/n/r/n. Knee dislocations happen when the kneecap slips out of the patellofemoral groove. This is very painful and can damage the joint cartilage. Causes of patella dislocation include /r/n/r/n. Once a patella has been dislocated, it's easier for it to happen again. /r/n/r/n. Treatment for an injury to the patellofemoral joint depends on the cause and severity. Possible treatments include /r/n/r/n. Problems with the patellofemoral joint can cause significant pain and disability. However, you do have a lot of treatment options available that can get you up and walking on that leg again. If you injure your knee or begin having pains that could signal a patellofemoral joint problem, see your healthcare provider about it. The sooner you get a diagnosis and treatment, the sooner you'll be functional again. /r/n/r/n The patellofemoral joint is located in front of the knee and is a complex structure of muscles, connective tissue, and bones. It is where your kneecap connects to the thigh and shin. /r/n/r/n Patellofemoral pain syndrome is often caused by overuse during running or jumping sports, muscle imbalances or weaknesses, trauma to the kneecap, or ACL surgery. Commonly known as runner's knee, its irritation and inflammation causes pain at the front of the knee. /r/n/r/n Patellofemoral syndrome is treated with rest, ice, compression, and elevation, anti-inflammatory medication, and physical therapy exercises. In rare or more severe cases, surgery may be required. /r/n/r/n Patellofemoral syndrome is usually treatable, but the time to find relief depends on the severity of the condition and if there is any damage to surrounding tissues. If treatment is delayed, it will take longer to heal. /r/n/r/n Knee arthritis is typically due to osteoarthritis, a progressive wearing away of the protective cartilage in the patellofemoral joint. It is treated with physical therapy, exercise, heat or ice therapy, and pain medication. In rare cases, it can be caused by rheumatoid arthritis, and disease-modifying anti-rheumatology drugs, DMARDs, can bring relief and prevent further joint damage. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.